Did you know that balancing your hormones can play a critical role in your body's ability to fight cancer? Now, this even applies for triple negative cancers and cancers that you don't normally associate being hormone positive. In this video, I'm going to be covering all of the things that you need to know to achieve hormone balance and to give you that upper hand in fighting cancer in the most effective way possible. Now, most of us associate hormonal issues with the fluctuations that women get during their menstrual cycle, breast tenderness, feeling maybe crazy the week before you get your period, or even the hot flashes and night sweats, the joint pains, the vaginal dryness, all the things that we know are dependent on estrogen, either too much or too little of in the system. Now, when it comes to cancer's growth, the typical treatment for hormonal dependent cancers is to squash the estrogen altogether. So when you're totally depleting estrogen in the body, that leads a whole other host of issues like bone pains and risk for osteoporosis and heart disease. Just recently, I had a young athlete in my office diagnosed with hormonal type breast cancer. She was in the best shape of her life, athletic, had lots of energy. She had the best diet. She was feeling really good. So how does somebody like that develop a hormonal cancer? Now, just to give you some context here, not all estrogens are bad. They actually break down into 3 different types of metabolites. So if we were to look at this in a pie chart, the 2-hydroxy is actually the safest form of an estrogen metabolite that is very protective against breast and ovarian and endometrial and cervical cancers. And then there's 2 other types of metabolites called 16-hydroxy and the 4-hydroxy that are actually more dangerous and more of a predictive factor when it comes to stimulating cancer's growth. So we want to implement strategies to keep this 16 and 4 as low as possible and the 2-hydroxy as high as possible in your system. So instead of implementing a strategy like a tamoxifen or ones that completely affect all the estrogens in the system and increase your risk for other types of diseases, you want to be more specific in just lowering the ones that have that proliferative and cancering effect on the body. So the best ways that you can enhance the 2-hydroxy and have the good types of estrogen and keep the 4 and 16 low is by enhancing cruciferous vegetables in the diet. So cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, bok choy, all of those are high in glucoraphanin, which is an antioxidant that helps your liver detox these bad estrogens. For this patient specifically with breast cancer who is already quite athletic and ate a lot of healthy things in her diet, she realized that she did not have enough of it. So unless you're having 2 pounds of broccoli a day, it may actually be beneficial to take 1 capsule of sulforaphane or DIM or indole-3 carbinol to enhance how your liver is detoxing this estrogen. So checking your hormone metabolites may make all the difference when understanding how to balance your hormones. So with certain patients, like this one with breast cancer, we implemented high liver detoxifying foods, certain supplements, coffee enemas, an anti-inflammatory diet. We did all the things to change the high 16 and 4-hydroxy, shuttle that more into the 2-hydroxy pathway to have more of a protective effect. This patient has been in remission for many, many years. We've also realized that she overexercises. So that's one of the issues genetically. If some people do not know or their body can't control inflammation very well, then too much exercise, too much stress on the body can actually have more of a driving effect on cancer's growth versus it being more beneficial. I had another patient with renal cell carcinoma who had an issue with getting his testosterone up. So he started taking testosterone injections. And a lot of men do this, thinking whether it's for muscle growth, for working at the gym, just for more energy. Even I've seen a lot of females supplementing and taking testosterone creams and potions and gels and all the things to help with focus and energy and sex drive. However, if you're taking testosterone and you do not know what your hormones look like, that can be a huge problem in the lens of cancer. So what happens is testosterone can actually shuttle into this estrogen pathway, and it can create more of a proliferation effect on cancer cells. And so what happens if you're jacking up the testosterone, shuttling into estrogen, and then these estrogens are not focused on that 2-hydroxy pathway, then that's setting up the stage for pushing more of a cancerous process. So if you ever want to consider supplementing with a hormone, whether it's bioidenticals or wild yam or natural testosterone like maca or things to really pump up natural hormone production, it's really important that you get your hormone metabolites checked, also looking at your genetics to see how your body is converting these. Now let's not forget about your adrenal glands, your stress glands. These are the glands that help you get through the day and help battle anything that really comes your way. But if you're in this go, go, go stress mode all the time, you can have what's called a pregnenolone steal. So a lot of the attention is going from the sex hormone pathway and healthy libido and healthy skin, healthy hair, all the things that we associate with healthy sex hormones, and it's going into this survival pathway. In order to have balanced hormones, you do need to look at not only the estrogen and progesterone, testosterone, but also how your body is producing this cortisol, because high cortisol is going to affect all of the other sex hormones. One of the top questions that I get when it comes to balancing your hormonal health is, how does fasting play a role? Is that going to have a detrimental part in your hormones? Is it going to throw them all off balance? Or is it going to have more of a protective effect? Make sure to watch the next video to learn all about fasting, your hormones, and ultimate cancer care.